future doctors. Welcome back to Best Medicine's GCSE AQA Biology lecture series. In this lesson, we'll be talking about hormones, puberty, the female menstrual cycle, some birth control methods, and some methods of treating infertility. So, starting with puberty, what is puberty? Puberty is the growth spurt that occurs as we enter teenagers. So during puberty, essentially what occurs is that we have reproductive hormones like testosterone in males and estrogen in females that will help control the development of secondary sexual characteristics. So our secondary sexual characteristics will develop during puberty. What about primary sexual characteristics? What are those? Primary sexual characteristics are those that you inherit at birth, right? For example, males have testes and females have ovaries and so on. Those are primary sexual characteristics. However, once we enter puberty, then males will start developing their own special features and girls will develop their own special features, right? And that is called the secondary sexual characteristics. Okay, so primary sex characteristics like ovaries in girls and testes in boys will eventually end up producing these hormones and gametes that are essential for reproduction. They will have a spurt or increased production of these hormones, causing specific changes at a certain age. So when the timing and rate of puberty vary, while the timing and rate of puberty vary among individuals, the fundamental transformations are universal. And you probably, because we have recently gone through puberty, you guys have recently gone through puberty, you guys should be well aware that in boys, they get facial acne and their height increases, and they also start getting these muscles. While in girls, their height increases, right? And they also get acne, and we all get hair in our pubic regions and so on. So first up, we're going to start with the puberty in females. Now, the main female reproductive hormone is estrogen, okay, also called estrogen. This is produced by ovaries. Rising estrogen levels trigger the development of female secondary sexual characteristics. So estrogen is the one that is causing the development of female sexual characteristics. This is produced by the ovaries, and usually the surge in estrogen occurs between the ages of 8 and 14. Okay, by 14, it's pretty much finished. It's very, very late, but by 14, puberty should be finished. The key changes include a growth spurt, of course, the development of hair under the arms and in the pubic region, breast development, and additionally, the external genitals grow and darken, and a female pattern of fat is deposited on the hips, buttocks, and thighs. The brain also matures. It undergoes changes that give females their own specific advantages in thinking. For example, females are better at multitasking than men. And that is one of the reasons that could be behind it, is because of estrogen that is causing this brain development. Also, the reproductive organs will grow, so the uterus also grows and becomes active. And at the end of puberty, menstruation is going to begin. Or during puberty, actually, menstruation begins. So what is menstruation? What is that? What is the menstrual cycle? You probably heard of it as the female monthly cycle, right, in our daily lives. How does that work and why does that occur? And because we're trying to become doctors, we have to understand this very, very closely. So the menstrual cycle would eventually involve the ovaries and the uterus. So let's have a look and draw those. So remember, a uterus is a pear-shaped organ. So let's get a uterus here. And then let's get some ovaries here. So one ovary on the right and one ovary on the left. When a female is born, meiosis has already occurred and gametes were already created. Those gametes exist inside the ovaries. So inside the ovaries, you have the egg cells, the ovum. A female has a limited supply of ovum, of egg cells, and they are present inside the ovaries. So you have a lot of these over here, okay? That's one of the major things that we're going to talk about. The other thing that we're going to talk about is that in the uterus, there is a muscular lining, okay? Over here. So the inner wall of the uterus essentially is very soft and very comfy and very smooth, and the reason for this is because this is supposed to be the housing site, the resting site for the embryo, right? For the fetus. The fetus is supposed to be implanted here. Once an egg fertilizes, a zygote is formed, an embryo is supposed to be implanted on the uterus. It has to have this very nice cushioning layer of muscles and tissue here. So that is called the uterine lining, okay? Uterine lining. And in medical terms, it is also, or more advanced terms, it is also called the endometrium. Endometrium. All right. So every monthly cycle, this uterine lining is formed and then it degrades off, okay? And then it is reformed and then it degrades off, and then it is reformed and then it degrades off. So once per cycle, once per menstrual cycle, this is going to degrade, fall off, shed off, and it will reform. These two things are going to occur. While talking about the egg cells, something also happens to the egg cells. So there's two things that we need to take into consideration. Number one, what is happening to the egg cells? Number two, what is happening to the uterine lining? The egg cells, they start developing a follicle around them. So what is happening to the follicle and what is happening to the uterine lining? Remember we talked about pituitary gland and that it releases follicle stimulating hormone, right? FSH is going to come in, follicle stimulating hormone is going to come in at day 1. And at day 1, it is going to start stimulating some of the egg cells here to start developing into follicles. So a little bit of a follicle is going to develop around an egg cell. So here's an egg cell, maybe at day 2, and then it's going to go ahead and become bigger follicle. And so on. What is a follicle? A follicle essentially is just a layer of cells and some fluid that surrounds the ovum. And so over here, this has become quite big, and let's just call this the mature follicle. Okay, so that is the mature follicle. So follicle development starts at day 1. Let's say this is day 1, or etc. And then mature follicle at day 14 of the female menstrual cycle. Once the follicle is mature, then what happens is that LH is released. Okay? LH is going to come in, and LH is released. LH will cause this follicle to rupture, releasing the egg. But let's just hold there and go to the uterine lining, because we also have to understand what is happening to the uterine lining during this time. So remember what the uterine lining is that it is a layer of soft tissue that lines the inside of the uterus where the egg is supposed to be implanted. Now here's the thing. Uterine lining is being maintained by a hormone. And at day 1, there is none of that hormone. That hormone is called progesterone. I'll tell you why there is no progesterone in a bit. But let's just assume for now, for understanding, that at day 1, there is no progesterone. And what does progesterone do? Progesterone maintains the uterine lining so that it stays there. If there's no progesterone, there is no maintenance of the uterine lining, and you have to take the word maintenance, not proliferation, not growth. Okay, just maintenance. So if there's no progesterone at day 1, I'll tell you why that is in a bit. Then there is no maintenance of the uterine lining. So no maintenance means that there's nothing holding the uterine lining in place. So what happens is that it's going to start falling off. It sheds off and bleeds. Okay? A little bit of blood is going to come off. The lining itself is going to come off, and it's going to go down this tract. What is the tract underneath the uterus? Well, there is a little bit of a place called cervix here. Okay? Remember when we were talking about HPV and cancers? We said there's something called the cervical cancer in females. And that is the cervix here. So it's going to go through the cervix into the vagina and then outside. Okay? So starting at day 1, when there's not sufficient progesterone, the uterine lining bleeds out, right? Starts bleeding out. This would occur from day 1 to 14. So day 1 to 5 or 7 is the bleeding phase. The uterine lining sheds. Bleeds out. Okay? At the same time, on day 1 to 5 or 7, FSH was being released by the pituitary, and it was influencing the development of follicles in the ovaries. So let's start making a timeline of this. So here's what's occurring, right? We have events that are occurring, and then over here we have time. So at day 1, this is 0, right? Day 1 to around 5. For the uterine lining, we have menstruation occurring, right? The menstruation is the shedding of the uterine lining, okay? Uterine lining sheds from day 1 to 5. Lining sheds from day 1 to 5 because there is no progesterone to maintain the uterine lining. Now, after day 5 to around day 14, what happens is that this is going to start developing, okay? So uterine lining now is going to start developing. Development, or you also call that growth of cells, right? Growth of cells is also called proliferation. The proliferation of the uterine lining is going to occur from day 1 to 14. So let's hold on there and go back to our follicle. What is happening to the follicle? Well, follicle is just developing from day 1 all the way to day 14, right? Follicle develops due to FSH. Okay. Now, at the same time, keeping all of this in mind, let's draw another timeline here for hormone levels. So here's hormone levels now during those 28 days. So this is going to end at 28. Here's time. What is happening to the hormone levels? Well, FSH is a little bit high, okay? It's a little bit high. That is FSH. And what the follicle stimulating hormone is doing is that it is stimulating the follicles to develop. What about estrogen? Estrogen is low. Here's estrogen from day 1 to 5. Estrogen is low. Why? Because the function of estrogen is to develop, is to proliferate the uterine lining. Okay? That is a function of estrogen. So estrogen, of course, from day 1 to 5 at least, or 7, during the menstrual phase, estrogen is going to be low because we're trying to shed the old uterine lining. Okay? So from as long as the menstruation phase is there, the estrogen is going to be low. But as soon as it is over, estrogen is going to start increasing again. Okay? Estrogen being secreted by the ovaries is increasing. Why? To cause the development, the proliferation of the uterine lining. So this is estrogen. And after day 5, it starts proliferating the uterine lining and so on. Now let's go back to our diagram. So we have looked at from day 1 to 14. Again, let me repeat this. Day 1, in terms of follicle, from day 1 to 14, what is happening is FSH is coming in and it is constantly stimulating the follicle to develop around the egg, right? Until the egg is fully mature at around day 14. What is happening to the uterine lining is that from day 1 to around 5, there is no progesterone. So the uterine lining is falling off, it is shedding off, and we call that menstruation, the menstrual phase. So day 1 to 5 or day 1 to 7 is the menstrual phase. Then after day 7 or day 5 to 14, we have the proliferation, the building up of the uterine lining again, right? And that is being driven by estrogen. So estrogen is going to come in day 5 to 14. Estrogen stimulates proliferation, development of uterine lining again. Now what happens at day 14? Day 14 is a very important day, and they like to give you this in the questions in the exams. At day 14, LH is going to come in, right? As LH comes in, it's going to cause this follicle to rupture. The follicle will rupture, forming a structure called the corpus luteum. So here's the follicle. It has ruptured, and it has formed this banana-like structure called corpus luteum. And as a result of its rupture, it has released the egg into this tube that is leading all the way to the uterus. This tube, because it connects the ovaries to the uterus, this is called the oviduct, also called the fallopian tube. So the oviduct, or the fallopian tube, starts providing a pathway for the egg to start moving down towards the uterus. So the egg now is going to start moving towards the uterus, right? Now when the egg is about here, still inside the fallopian tube, possibly a sperm cell can come in. A sperm cell can come in and fertilize this egg. When the sperm cell will fertilize this egg, it will end up forming a zygote, right? So here's a zygote. And then that zygote will end up implanting in the uterus, right? Usually. So at day 14, LH comes in and causes the rupture of the follicle, releasing the egg into the fallopian tube. The remainders of the follicle, they become a structure called corpus luteum. And that is very important. Why? Because corpus luteum, as soon as it is formed, around day 14 to 15, this is going to start secreting progesterone, okay? Progesterone. So this is the one that is making progesterone, and progesterone will further maintain the uterine lining. So let's go back to our diagram here. So FSH is here, and then we have a sudden increase in LH. So LH, let's make this in yellow. Here's LH is there's no LH, and all of a sudden on T14 there's a lot of LH, right? And then it goes back to 0. So that is LH, and that is causing ovulation. Okay? LH causes ovulation, the rupture of the follicle, releasing the egg into the fallopian tube, forming a structure called the corpus luteum. Now here's the thing, as soon as corpus luteum is formed, now the corpus luteum is going to come in, and corpus luteum is going to start secreting its hormones. So corpus luteum starts secreting progesterone, and progesterone levels increase. Okay? So here's progesterone, and progesterone level increase. Estrogen falls a little bit, right, and then it is maintained. Progesterone levels increase, and this maintains the uterine lining. Okay? So, after the, so from day 1 to 5, when we look at the, with regards to the uterine lining, from day 1 to 5, we have the menstruation. We have the menstrual phase. Then after that, we have the proliferative phase, right? And then from there, we start secreting progesterone, right? At day 14, the corpus luteum is formed. It starts secreting progesterone. So from day 14 onwards, we just have this secretory phase in which we're secreting progesterone to maintain the uterine lining, okay? What about with regards to the follicle? Well, from day 1 to 14, there was follicle development. While from 14 to 28, there is no follicle, right? There's the corpus luteum. So we just call that the luteal phase. From day 14 to 28, we just call that the luteal phase. So basically, the menstrual cycle can be divided according to two different ways. One of them is that we can consider its phases according to the follicle. The first phase of the follicle would be from day 1 to 14. We call that the follicular development phase or follicular phase. While the second one is called the luteal phase from day 14 to 28. Or we can talk about the menstrual cycle with regards to the uterine lining. And we can say, okay, the uterine lining sheds from day 1 to 5. So that's the menstrual phase. Then it proliferates from day 5 to 14. So that is the proliferative phase. And then it secretes progesterone from day 14 to 28. And that's the secretory phase. Okay? And so on. from day 5 or day 7 onwards to day 14, and that is driven by the hormone called estrogen. Estrogen is secreted by the ovaries that acts on the uterine lining to try to proliferate it. After ovulation, we have the formation of corpus luteum. Corpus luteum then, from day 14 onwards, it starts secreting progesterone, which maintains the uterine lining. If fertilization does not occur, then the corpus luteum will degenerate. This will cause the uterine lining to fall off or shed, marking the beginning of another menstrual cycle. Okay? So this is the normal 28-day menstrual cycle. Here's a wonderful image that I have taken to try to illustrate this again. So here, very quickly, if you look at this, in terms of the follicle, we have the follicle that develops from day 1 to day 14. On day 14, we have ovulation that is driven by LH. And then from there onwards, we have the corpus luteum that eventually degenerates at the very end of the menstrual cycle. The estrogen starts increasing after the menstrual phase. The progesterone starts increasing after the ovulation. Okay? LH only has a surge around day 14 to cause ovulation. And so on. Here's the menstrual cycle, the uterine lining as well in this wonderful diagram. So from day 1 to 5, 6, 7, we have menstruation, the menstrual phase. Then we have the proliferative phase. Okay, and then we have the maintenance phase. In terms of the follicle, we have two phases, follicular phase and the luteal phase. Okay? This is very, very difficult and very important. It's very easily forgettable. So I hope you guys can review this particular diagram a couple of times. If you can memorize this diagram, then I think that should be the entire summary of it. So summarizing this for the third time, once a girl has gone through puberty, she will have a monthly menstrual cycle. The menstrual cycle can be described according to two simultaneous ways. So one of the ways in which we can describe the monthly menstrual cycle is according to the follicle. Day 1 to 14 will mark the follicular phase, in which FSH comes in and causes maturation of the follicle. At day 14, there's a surge in LH, which causes the mature follicle to rupture, that is ovulation, releasing the egg into the fallopian tube and forming a structure called the corpus luteum. The luteal phase. The remaining follicle becomes a structure called the corpus luteum. The corpus luteum starts secreting progesterone, which maintains the uterine lining, okay? It does not develop it. What about according to the lining of the uterus? How can we describe the menstrual cycle according to the uterine lining? Well, from day 1 to 5, or sometimes even 7, menstrual phase. That is when the uterine lining bleeds out and sheds, because we don't have any progesterone to maintain it. From day 6 to 13, we have to proliferate this. We have to reform the cells and reform the soft and nice cushion to house the embryo. This occurs due to increasing estrogen, which is released by the ovaries, that causes development of the new uterine lining. On day 14, ovulation occurs, causes formation of the corpus luteum, which starts secreting progesterone, marking the beginning of the secretory phase. The secretory phase really is involved in maintenance of the uterine lining. Now here's the thing. If there is no fertilization, then the corpus luteum breaks down. But if there is fertilization, then the corpus luteum does not break down. Okay? And that keeps on maintaining the uterine lining on which the embryo will be implanted. Okay? And that's really it for the menstrual cycle. Something very interesting that I want to talk about is about the female fertility. The ovaries of a baby girl, right, a girl who has just been born, contains all the eggs that she will ever have throughout her life. So as she grows up, she already has all the eggs that she will ever have. She inherits it from her grandma. After puberty, these eggs mature and are released every month until menopause. So because you only have a specific number of eggs, eventually the female will run out of the eggs. And this usually occurs at the age of 51, when you run out of the egg, and that is called menopause. Around the ages of 40, I think, not 35, but 40, we call that premenopause. when it starts off just a little bit. But menopause truly is around at the age of 51. So as menopause approaches, a woman becomes less fertile and has a higher risk of having a baby with genetic problems. So that's a little bit of a clinical correlate there, that it's better to have a baby in the early ages as compared to later ages. Testosterone and puberty in males. The main male reproductive hormone is testosterone. We already looked at this. Basically, testosterone is released by the testes, right? And as testosterone levels rise, essentially some of the changes would occur to our bodies. One of them is that we develop bigger muscles, right? We start getting these facial acnes. Our skin is the external genitalia increases and the skin on it darkens. The larynx gets bigger and we start getting this deeper voice. And the testes, they become active and start producing sperm. We also start getting pubic hair. Okay, so that is the puberty in males. We already looked at puberty in females above. An often tested concept in GCSE AQA, which came in the exams this year as well, is contraception. Contraception means taking measures to avoid pregnancy. Now, there are many contraceptive methods, and we have to discuss a couple of them down below. So, does any one of you recognize anything from this image? I think we are all aware of what this is. What about this one, this T-shaped thing? Any ideas? And what about these pills? This T-shaped thing is called an IUD, intrauterine device. Okay, and of course, this is a condom, and these are pills. Okay, so the first contraceptive method that we're going to look at is oral contraceptive pills. Oral contraceptive pills, or OCPs, sometimes also called the pill, I'm on the pill, right, contain estrogen and progesterone. Remember estrogen? Estrogen, what it does is that it inhibits FSH release, so the follicle does not develop. Okay, so estrogen inhibits FSH, which means that the follicle does not develop. If follicle does not develop, then you're not going to have fertilization, right? And even if a follicle does develop, there is a very less chance of ovulation. So it also inhibits LH, thereby preventing ovulation and thereby decreasing the chance of fertilization. Number 2, we have barrier methods, and we're all well aware of these. So essentially, we have a physical barrier that prevents it. For example, male condoms as well as female diaphragms. Now, this is highly effective, it's cheap and easy to use, and it also prevents from sexually transmitted infections such as AIDS, HIV, gonorrhea, chlamydia, etc. There are 2 kinds of condoms. We have both male and female condoms, right? The diaphragm. Number 3, which is intrauterine device. IUDs, they prevent embryo implantation by making intrauterine environment unstable. So here's what occurs really. This T-shaped device that you see here, it has many different shapes. This is the most common shape, but you could have multiple shapes for this. It's usually made of copper. There are copper IUDs. There are other kinds of IUDs as well. And so what happens here is that as this goes into the uterus, it makes the uterus have a very chronic sort of an inflammatory environment, and an unstable environment. So because the uterine environment is unstable all the time, even if a zygote tries to come in, it will not be able to implant itself, thereby preventing fertilization. Okay, preventing implantation. So that is IUDs. Number 4, we have abstinence, abstaining from intercourse entirely except for breeding. And this is practiced among some religious groups. It's not very popular and it's not very effective either. So they actually did some researches on this, and they discovered that it's not as effective. We also have the withdrawal method, which is essentially just ejaculating outside of a vagina, and that's also a popular practice. But again, these are proven to be less effective than other methods, according to researches. Number 5, you have surgical methods. Surgical methods would include vasectomy for males, which essentially clips off the spermatic duct that brings the sperm from the testes, and hysterectomy, which essentially removes the uterus. And there's also something called salpingotomy. Salpingotomy is the fallopian tube removal. So you just remove the tubes here. Just remove the tubes, and the egg cells are not going to be able to reach the uterus. But again, these are permanent, non-irreversible. Next up, you have infertility. So, what is infertility? Infertility essentially is the inability of a couple to conceive a child. Clinically, it is defined as inability of a couple to conceive a child after 1 year of regular, unprotected sexual intercourse. But essentially, for AQA, you just need to remember this, okay? Infertility is just not being able to have a child. And there's so many different causes for this. Causes could include something like hormonal imbalances, right? Structural problems with the reproductive organs, age-related factors, menopause, for example, right? Certain medical conditions. So infertility can be diagnosed through a series of tests and so on. How can we treat infertility? It may be treated, some kinds of infertilities can be treated. Now, what are the treatment methods for infertility? One of them is called in vitro fertilization. In vitro fertilization essentially is an assisted reproductive technology where an egg and sperm are combined outside the woman in a laboratory dish. The way I like to describe this is test tube babies. Test tube babies. You see this particular diagram here in which there's a baby inside the test tube. Basically what they do is that they take the sperm. So you have the test tube here, right? And they take the egg cells, right? And they mix that with semen, and that gives a very good chance of fertilization for the egg cells. So once these are fertilized, the zygote will then be allowed to duplicate itself a couple of times to become a small clump of cells, and then that clump of cell is then taken and implanted into the uterus. So let's have a look. So here's the zygote, right? And it becomes a clump of cells, and then that is implanted into the uterus. Now, this could be done for example, if the fallopian tube is blocked, right? Fallopian tube is blocked, the egg cell is not able to reach the uterus, so you can just take the egg cell directly from the ovaries and try to fertilize them in a test tube. It can also be used for severe male infertility or unexplained infertility. How do you get the egg cells? You get the egg cells, first of all, by stimulating them using FSH. So you give FSH, causing the eggs to be stimulated, and then you retrieve the eggs, and then take them to the test tube and fertilize them using the sperm. Okay? Next up, we have intracytoplasmic sperm injections. This is really for male infertility. What happens here is that there is a male sperm that is not a good swimmer. Okay? So because it's not a good swimmer, it's not able to reach the egg cell. If it's not able to reach the egg cell, it's not going to be able to fertilize it, and therefore you have this infertility going on. So the solution for this is that you take the sperm and you directly inject it into the cell, into the egg cell. Okay? The sperm will not have to swim towards the egg cell. Instead, you take the sperm and you inject it into the ovum itself. And hence the name inside cytoplasmic cytoplasm sperm injection. You inject the sperm in the cytoplasm of the egg cell. Okay? And this is used for severe male infertility in which the sperm is not a good swimmer. Okay? Very easy. So what are some of the advantages and disadvantages of infertility treatments? This is a low yield concept. I'm just going to write this here. Low yield, because it doesn't often show up on the exams. But some of the advantages, of course, fertility treatment is that it enables parenthood, and it overcomes various infertility issues, and it also helps us advance in science. What are the disadvantages of fertility? Well, of course, it's high costs, and this might come up on the exam. Disadvantages: high costs, health risks and stress, and increased risk of multiple pregnancies. Okay? So that finishes this particular lesson on the female reproductive cycle, fertility treatments, as well as to prevent fertilization, contraception. So I'll see you guys in the next one, and I hope you guys can share these videos with your classmates and your friends. And if you have any questions, just let me know, okay? And if you want to book some lessons from some of the other tutors that we have as well, then you can just let us know in the WhatsApp link below, okay? And I'll see you guys in the next one.